Yeah, hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is all about on sepsis. As every healthcare professionals and nurses should know that sepsis is a global health emergency, and every hour of delay increases the risk of death. So, for joining this discussion, we have now with us Dr. Karthik, who is our senior consultant critical care physician from Yashoda Hospital's Somajigoda unit. I welcome you, Dr. Karthik.
Yeah, hello all. Good afternoon. So I'm Dr. Karthik here. So I'm a critical care consultant at Yashoda Hospital. So it's good to see that we have a webinar now immediately after the sepsis update is released. So we shall discuss about the new sepsis update and being the frontline warriors and being the first persons to recognize nursing staff would be the first person to see the patient in the bedside and watching every time, so it would be very important for them to know the signs and symptoms of sepsis to recognize the sepsis early. So in the sepsis, one important thing is that the time is tissue. So whenever we delay, there will be increase in the mortality. Okay.
Yes.
So it's better if we recognize early, and it's better if we know the recent sepsis updates. So it's good to see that we are we are on a webinar now.
Yes.
Yeah.
And I request everybody to just keep this session time bound. And now I request all the speaker to introduce. Yes, over to you, Yasmin.
Hello everyone, good afternoon. Myself Narsima Yasmin Laskar. First of all, I thank Mrs. Shanti ma'am for giving me this opportunity to be a part of in this session. So sepsis is very important, and early identification of symptoms of sepsis can save the life. So I am very excited to enlighten my knowledge on this regard. So thank you.
Yes, over to you, Parvati.
Good afternoon, everyone. Nazlin this side.
Yes,
I
yes.
would like to extend my sincere thanks to Ms. Shanti Bhattacharya ma'am. I am truly honored to be a part of this session. Looking forward to a great session.
Yeah, and Naslin, yes, you are visible right now. And Parvati.
Good evening, everyone. Myself Parvati, working in ICU in charge. I'm grateful to the opportunity of this webinar. Thank you to Shanti ma'am and Dr. Karthik sir.
Yes,
Hello,
yes.
Parvati.
Hello, sir.
Thanks to you all also, because yeah, let us see what we have in this discussion today, and we'll just we'll keep this session very time bound. So this first insight I would like to learn from Dr. Karthik is
Yeah.
the PPT itself says, is sepsis always life threatening? Because even though guidelines are changing, a lot of new updates and a lot of safe care interventions are in place. So yes, over to you for your crisp reply on the same. Yeah.
See, sepsis is a life-threatening emergency. It's a medical emergency. Okay.
Yeah.
Always when a patient with sepsis comes, it's first very important to recognize whether it's sepsis or not. So in the recent guidelines also from 2021 and now updated in the 2026, they have clearly mentioned sepsis as a like definite sepsis, probable sepsis, possible sepsis, and unlikely sepsis. So
Yes.
based on these types of sepsis, if it is a definite sepsis, we should follow our 1 hour bundle and we should administer our antibiotics as soon as possible, and we should take cultures before the antibiotics, and we should see the trend of these lactates. Okay, and these all things are important. Fluid resuscitation, and it should be like within 3 hours of how much amount of fluid to be given. All these things are indicated in a definite sepsis. So when it's a probable sepsis and possible sepsis, the time of antibiotic administration may differ. So it's very important to know the sepsis, to identify the sepsis, and even now in the 2026 update, they have mentioned about the quality improvement programs in the hospital
Yes.
to recognize the sepsis early.
Yes.
Now they even mentioned that even prior to the arrival to the hospital, pre-hospital also there is a need for antibiotic administration. These have been specified in this sepsis update now in 2026. So
Yes.
what all they try to say is identify the sepsis early and start the treatment early. So that's
Administer
the
it.
main thing. Yes.
Yes. Yeah, going forward, yes. Over to you, Naslin. And I think one by one we will just finish it. That is this discussion. Yes. Yeah, Nazleen, over to you.
Thank you so much, sir, for your valuable input. We just want to know the basics, like how we define it sepsis in a simple word. Like for nurses, it's really important. We call sepsis is a life-threatening, and we indulge into very complicated terms like it may lead to organ failure and all such things. So for us to know the basic is really important. So how we define sepsis in a simple word? Over to you, sir.
Yeah. Sepsis is a life-threatening emergency, as I said. So it's a dysregulated host response to the infection. So whenever an infection comes to our body responds in such a way that it will release all the cytokines, all the inflammatory markers, and these inflammatory markers, apart from combating the infection, whatever may it be bacteria, may it be fungus, or may it be viral, apart from combating the infection, it will also destroy our own cells. These inflammatory markers will also cause increased response in our body. So increased inflammatory response. These increased inflammatory response will further lead to the organ damage, multi-organ failure. All these things will ensue. So this is a dysregulated, means it's a hyper response to an infection. So recognizing a sepsis is important. Whenever the patient comes to the ER or whenever the patient is in the ward, whether how to identify the sepsis is important. So there were
Yes.
screening tools previously, like in the last sepsis update in 2021, they have used a screening tool of QSOFA.
Q-SOFA, yes, yes.
So sequential organ failure assessment. In that, the three criteria are high respiratory rate and systolic blood pressure less than 100 and altered mental status. So these three were included, and what's the drawback of this quick sofa and why we have replaced from quick sofa to now to Muse, MEWS is,
MEWS, yeah.
yeah, the quick sofa is highly specific. Whenever a sepsis patient is really having sepsis, these patients, they will definitely have a score of more than 2 in a quick sofa. But
Yes.
it's less sensitive. Like this low pressures, high respiratory rate, and altered mental sensorium can also be there in other presentations, like in pancreatitis, like in acute
Yes.
lymphoma, like in heart failure, like in pulmonary embolisms. So it's like it's highly specific when it is sepsis, but it's less sensitive to diagnose to detect a sepsis.
Yes.
So
Yes.
that's the reason now they have included modified early warning signs in this update. So modified
Is
early warning signs, it's clearly now many hospitals they are using it in the wards
yes.
to know
Yes.
whether the patient has shifted from his hemodynamics or else his vitals, whatever we are seeing in that, whether it is in the white line or yellow line, if it's crossing from yellow to
Yes.
orange, it's some indication that the patient is having some sicker problem. So it's an
Yes.
indication that the patient is going into the sepsis. So
Yes.
Muse has got a good sensitivity to detect the sepsis. So that's the
Yes.
reason they have specified Muse as the better screening tool than the Quicksoap, and they have Quicksoap they have underscored it now compared to the previous
Yes,
update.
yes. I was even going through, and I even wanted to ask that is it executed, and then now you just cleared it, saying that it has its own delimitations and not
Yes.
much evidence we found it. Yes. Going forward now, Parvati, we would like to understand. I mean, you're the real hardcore critical nurses, and you work in the ICU. So now, like as we were discussing, you get these when you receive patients. So what kind of symptoms, early symptoms, or may not be these symptoms are present or signs are present. So can you just share your experience with us, like what kind of diagnosis you receive and what kind of signs, symptoms receive the patient with? Yes, over to you in short.
Yes, ma'am. Yeah, ma'am. Thank you for a great opportunity, ma'am. So coming to the criteria, we consider that the patient in leading up to the sepsis based on the few parameters like a temperature, high temperature in continuously, tachycardia, more than 90, tachypnea, and hypertension, and systolic BP was 90, and mean artery pressures was 65, and
Okay.
65, and vitals will based on that hypotension will be there, temperature will be there, and patient TLC count will be high in the, and coming to the blood investigation reports will be TLC will be more than 12,000, CRP will be elevated and more than 25 2 mg per dl, and procalcitonin will be elevated, procalcitonin will be elevated, and lactase will be elevated, and also they will land up with the organ dysfunction such as a less urine outputs.
Yeah,
It
oliguria.
will be
Yes.
alternative sensorium also it will be there, and when all those symptoms will be there in the patient, when patient came to hospital, we can identify that all those parameters. Then
And
within 1 hour we can fluid resuscitation and giving antibiotics, and within 1 hour we can insert a treatment. Then I have a question to sir, Dr. Karthik sir.
Yeah.
Then if patient have a same sepsis, all the patient sepsis or same symptoms will be there, then how we can consider which antibiotic we can prefer that within 1 hour we can give that to patient to prevent to the at least sepsis.
So, yeah, it's a very good question. So it will be based upon the patient history. So in
yeah.
the sepsis also, as you have gone to the previous slide, there we have clearly mentioned like a definite sepsis, a possible sepsis, a probable sepsis, and sepsis unlikely sepsis. So
Yes.
when the patient with definite sepsis is there and probable sepsis is there, we need to administer the antibiotics within 1 hour. And if a patient with possible sepsis with a shock is there, then also we need to administer the antibiotics within 1 hour. But a patient with the possible sepsis and without shock, we can wait
Okay.
till 3 hours. Okay, we can wait till 3 hours, and you need to find out the source of infection, whether is it infective or not. So entire physical examination is needed. So in the sepsis definition, also definite sepsis, its sepsis is confirmed by history, clinical
Yes.
examination, and diagnostic testing. So diagnostic testing, what we will be doing is in the first hour of sepsis, we will be sending blood cultures, and clinical examination later on, we need to find out the source of infection. Sometimes we can see a clear abscess. Sometimes the patient will complain with he might be having respiratory symptoms. So that's the indication that he is having some, if the patient is having severe respiratory distress, it's like he is having pneumonia. And sometimes if the patient is having abdominal pain, we can think of abdominal sepsis as the cause. So once you know the source of sepsis, then
Yes.
accordingly we might need to administer the antibiotics. So what
Yes.
the latest sepsis update says is you administer broad spectrum antibiotics, okay, based upon your local antibiogram. Means whatever in our community, what are the common organisms causing sepsis when a patient comes with from the community, and if he's in sepsis, so what are the common organisms which are causing sepsis are here. They are gram-negative bacilli. So we need to have a broad spectrum antibiotic which covers these things. And if we know the history, so they have mentioned history also in the definite sepsis definition. So
Yes.
the history, if the patient is having a COPD case, or else he is having a cystic bronchitis case, or else he is having a destroyed lung, so they might be having uh, infection of pseudomonas. So we need to give anti-pseudomonal coverage in these cases.
Yes.
What all antibiotics which have anti-pseudomonal coverage we need to put for this patient. So
Yes.
another thing is we have to know the history. From the history, we can know whether he has a recent hospitalization in the last 3 months or not, whether he is having home nursing care or not, whether he is a dialysis dependent patient or not, whether the patient is having any permacath, chemo port, all these things. From the history, we might know that the patient is having recent hospitalization, and he might be having colonization of the multi-drug resistant bacteria.
Yes.
And sometimes the patient can be having colonization of the gram-positive bacteria. So based on this history, we can put our antibiotics of coverage with covering gram-positive organisms, or else
Yes.
broad-spectrum antibiotics would be enough. And in some
Yes.
cases, we need to put anti-anaerobic coverage also. So cases like head and neck infections and skin and subcutaneous tissue infections and like a gynecology and obstetric sepsis cases, we might need to add anaerobic coverage also. And sometimes we
So,
uh, choose antibiotics which have both broad spectrum coverage and anaerobic coverage also, like
as well.
piperazolone, tazobactam, and like meropenem. So based on the history, history itself will guide to what to start, or else
Yes.
the broad spectrum antibiotic and with gram positive coverage, or else with anaerobic coverage is needed or not, that we'll get to know from the history. So based on
Yes.
this
Yes.
history and all these things, we'll choose the antibiotics.
Yeah, a very productive information you have provided. That is the reason we are, we request and we motivate all the nurses to just go through initially whenever you receive the cases, then just go through, as you said, definitive and probable sepsis are the etiology is very important to just guide the treatment. Yes. And yes, over to you, Yasmin. I think we'll just finish. The time is nearing. Yeah.
Thank you so much, Miss Parvati and Dr. Karthik, for sharing your insights on signs and symptoms and the antibiotic management for the sepsis. So, considering the immunocompromised patients and the ICU patients and those who who are in like chronic illness and multi-drug resistant patient. So, sir, I would like to request you to give your thoughts on the group of patients who are at more higher risk of getting the sepsis infection. So, over to you, sir, please.
So the question itself has the answer. So because they are immunocompromised, they are more prone for infections. So their natural immune system will not be capable to battle the infection. So in
Yes.
these patients, the chances of going into florid bacteremia, causing severe sepsis, causing shock is high. So any patient, uh, that's the this is where the screening tool comes into the picture. Okay, so immunocompromised patients with the symptoms of tachycardia, tachypnea, and white blood cell count variation, and fever spikes. So in these patients, if we put a screening tool like modified early warning signs and score, so we might know like these scores will evaluate our neurological status, will evaluate our respiratory system, will evaluate our cardiovascular system, will evaluate our renal system. Okay,
Yes.
so these five systems are examined. So based upon this scores, we can easily screen that the patient might be having sepsis. In the sepsis, what type? Whether it is definite sepsis, whether it's probable sepsis, whether it's possible sepsis, or else sepsis unlikely. So
Yes.
based on this, you can guide your further plan, like whether
Yes.
to administer antibiotics, when to take blood cultures, see the trend of lactates and fluid resuscitation. If the patient is needing fluid resuscitation, then next would be to see the trend of lactates, whether the hypoperfusion because of sepsis is it settling or not, whether the cellular metabolism is adequate or not. That we can know through the lactate clearance or else capillary refilling time. So based upon this early screening tool, we can guide our treatment. We can confirm
Yes.
whether it's sepsis or not. And in these patients, as you said, in immunocompromised patients, they are more prone for infection. So we should
Yes.
be very cautious. So early screening of sepsis is very important in these patients.
Yes.
Okay.
Yeah, that was
Thank
rightly said. Yes. Yes. Over to you, Nazrin. I
Yes,
think
as we were
yeah, yeah,
high
yeah.
risk,
Please take it.
so we got that clarity who are at high risk to get sepsis and all. But there's one more thing, like we should clarify whether it's contagious or not. Like my question is, can a patient with sepsis can spread to other patient? Like, is it contagious, or do we need to follow barrier nursing or any such things?
Okay.
Over to you, sir.
Yeah, yeah. as such, so many of our nursing staff and uh, whoever that healthcare providers would be having this doubt whether sepsis is contagious or not. Sepsis is as such is not contagious, but what's causing sepsis? Sepsis is the signs and symptoms which the patient exhibits. Okay, that we label it as sepsis. But what's causing sepsis is important. Whether the patient is having any bacterial infection, fungal infection, or a viral infection. So, what infection and what's the site of infection is important. So, if the patient is having pneumonia and he is into sepsis. So, pneumonia patient who is actively coughing, okay, and into sepsis, we would be treating sepsis. But that patient with that cough, he would be contagious. Got it?
Yes.
So as such,
Okay.
sepsis is not contagious, but the cause for sepsis, it can be contagious. Okay, so when the patient is having like bloodstream infections, so whenever the patient is on central lines or else any catheters, venous catheters,
Yes.
these patients, when they acquire bacteremia, and these patients, if we give a nursing care and if we don't follow proper hand hygiene techniques,
Yes.
then we
Yes.
might make the other patient susceptible for the infections.
Infection. Yes.
So we can cross spread the infection from one patient to another patient.
Other patients. Yeah.
So as such, sepsis is not contagious, but whatever uh, like
Other
principle.
source of hospital-acquired infections are likely to be high, and then they may
Yes.
transmit to others
Yes.
if they don't wash hands and the hand rubs are not properly used.
So this is where they have made bundles.
Yes.
Okay. So standard practice, they have given some standard practice guidelines. So
Yes.
this is where comes the bundles like WAB bundle, CLAPSI bundle.
Mm.
So if we follow this bundles set of practices, we would be limiting the cross spread of the infections.
Infection. Yes. Going forward, Parvati, are you there?
Yeah, yes, ma'am.
Yeah,
I'm there.
so already we have discussed about all these criteria, which clearly indicates that that patient is having sepsis. Now, we also wish to understand the blood culture, sending the blood culture like little protocol. Like, what is your practice like? 4 sets you send, or aerobic, anaerobic, when you send before giving the antibiotics, or what? Over to you for just little of your insight on the same.
Yeah, ma'am. Thank you for the opportunity. We can send the blood cultures when the patient was a fever spikes. Then we need to send the blood cultures before giving the first we will take the blood cultures. After that only we can inject the antibiotics.
Yes.
After that only we can send the blood cultures. We are practicing.
So how many sets do you send? Two aerobic, two anaerobic, two from
Two sets, ma'am. Two aerobics and aerobic and anaerobic culture
anaerobic,
two
yes.
sets will be sent, and two sides will be sent, left and right, two sides.
Yes,
If we difficult to take a samples, then we can and invasive lines from arterial and central line also we can take samples if it is
yes, right.
difficult.
Yeah. And this is a very, very aseptic technique we need to maintain, because
Yeah,
again, this
yes,
will
ma'am.
likely
Yes,
cause infection to the patient. Yes, I think Dr.
yes, ma'am.
Karthik, you also agree for the same, right?
Yes,
Yes,
definitely.
yes, yes. And yes, we were since 15 minutes we are talking only this. These indicators are very time sensitive, as you were mentioning that golden 1 hour we need to intervene. Like these are administered oxygen, take blood cultures, and give antibiotics, fluid, etc. I think we are aware of this little bit now. And yes, Yasmin, over to you for your insight you wish to understand. Yeah, and then
Yeah,
we
sir.
are.
Thank you so much for the opportunity, ma'am. Actually, sir, I wanted to know your thoughts and your experiences. What is the most common sign or the warning sign that the nurses are missing in the patient care areas to early identification of the sepsis? So, the common mistake that we are doing during the patient care.
Or any care related little forgetfulness, we can say, like
Yeah.
maybe they are
Also
not
the
knowing.
management, there is a like management that is a very simple that could have prevented the patient from getting the sepsis, but that we have missed the most common and the most ignored symptoms, as well as the management that we are doing in care
Yes.
practices, sir.
Yeah.
So may I
Apart
know
from
your thoughts on this, sir? Over to you, sir. Thank you.
It's like all the signs and symptoms are important. It's not like it's one is important, one is more
Yeah.
important than the other. So whenever we examine the patient, we should be watching for all the signs. Okay, like every score has given some set of signs and symptoms what we should be monitoring for, like
Yes.
what modified early warning score and the national early warning score and
News. Yeah.
SOFA, and previously it was SOFA. It has five components. So all this, what they stress is they try to see all the organs. They try to catch hold the signs and symptoms if any organ is failing. So sepsis as such causes multi-organ dysfunction. So it can affect all the organs. It doesn't affect only a single organ. When the patient is going into sepsis, if the patient is having pneumonia, and it's not like it only affects the lung, because
Yes.
there is infection in the lung, it's pneumonia, and if it is severe, it can cause sepsis. When once it's sepsis, it affects the other organs also. So we need to catch the signs and symptoms of all the organs, whichever is affected.
Yes.
So neurologically, we can see whether the patient is alert, whether the patient is having vocal output or not, whether the patient
Yes.
is having is responding to pain or not, whether it's unresponsive or not. That's what is AVPU score. Also,
Yes.
you can use GCS to know the
Yes.
GCS. How is it? So if the patient shows the signs and symptoms of his altered mental sensorium, we can think that because of sepsis, this might got affected. In the same
Yes.
way, if the patient is having low oxygen, high respiratory rate, and cardiovascularly, if the patient is having tachycardia,
Yes.
and the patient is having low pressures. Okay, these are all the signs and symptoms. And next, this you can know from the history and clinical examination. Clinical examination, but supporting this is what we do in the tests like blood cultures, and we see for the lactates, and we send for the complete blood picture to know the white blood cell count. These are all laboratory investigations
Examinations. Yeah.
which will support your clinical judgment.
I think that is how when the initial working diagnosis just documented as sepsis with modes and
Yes.
queries. That is how, we come to
So
the conclusion
previously,
about, yes.
previously it
It
was
was,
SIRS
yes.
response, systemic inflammatory response syndrome. Like there
Yes,
would be
yes.
tachycardia,
SIRS. Yeah.
temperature, and white blood cells, and tachypnea, respiratory rate. So if this in this four, if any two is positive with a documented source of infection, it's sepsis.
It
So
is
later they
sepsis.
found out that SARS response somehow it's less sensitive, and it's including other conditions like acute pancreatitis. Acute pancreatitis, the patient might not have sepsis. He might be having all these four, whatever I said. So it's like less sensitive. So
Yes.
then they have gone with QSOFA. Even QSOFA is also less sensitive, highly specific but less sensitive. So then they have come up with modified early warning scores.
News. Yes.
So, but
So,
what the latest guidelines suggest is use any one of the above. It's not like you don't use QSOFA now. You can use QSOFA, but it's less sensitive than news.
sensitive. Yes.
Now, news followed by Muse 2, followed by Muse MEWS, followed by QuickSofa, followed by SIRS. So the first comes the
Yes. Yeah.
Muse 2 score.
Yes.
Then comes the Muse, then comes the QSofa. So, but in a resource limited setting, so you can use any one of the thing to identify, but one is less
Yes.
sensitive than the other. It's not like one is not useful at all.
Yes. Yeah, I think yes, that is the reason we, request all the nurses that these pathways are very important. And yeah, as you said, Dr. Karthik, that any one of these indicators, if it is carefully examined along with subjective and objective data, I think we can prevent lot of patients going into a bad fatal condition. Yes. Having said so, I think sepsis, a broader terminology, and its varied parameters cannot be just finished within 15 to 20 minutes of time. So we end the session here. And I thank Dr. Karthik. In spite of your busy schedule, you have contributed, and thank you. And I thank to Yasmin, Naslin, and Parvati. Thanks for your participation. And I request all the viewers to refer www.Yashoda Hospitals for more health updates, academics, and also please watch patient testimonials for evidence-based learning. We end here, and thank you everyone once more. Thank you.
Thank you.
Thank you. Thank you.
Thank you.